Welcome to the presentation on understanding and treating attention deficit hyperactivity disorder, ADHD, in children. According to the American Psychological Association, the APA, attention deficit hyperactivity disorder, ADHD, is a neurodevelopmental disorder marked by persistent inattention and/or hyperactivity impulsivity that interferes with functioning or development. The goal of this presentation is to provide an overview of diagnostic criteria, prevalence, and evidence-based treatments for children with ADHD. It will conclude with a biblical perspective of the treatment methods. It is important to understand that ADHD is not due to parenting issues or bad behavior. It is a clinically defined disorder with biological, psychological, and environmental components. According to the APA, there are three types of ADHD: the inattentive type, the hyperactive impulsive type, and the combined type. For a child to be diagnosed with the inattentive type, they must show 6 or more symptoms related to attention, such as being easily distracted, frequently losing items, or forgetting daily tasks like chores. For the hyperactive impulsive type, the child must also display 6 or more symptoms, including fidgeting, difficulty playing quietly, and excessive talking. A child may be diagnosed with the combined type, where symptoms of both categories are present either equally or with one being more dominant over the other. Importantly, symptoms must begin before age 12 and interfere with functioning in more than one setting, such as at home and at school. It's also worth noting that in toddlers, ADHD symptoms can be difficult to distinguish from typical behavior, which makes early diagnosis more complex. Moreover, after the age of 12, symptoms may be better explained by other disorders or by substance use. Regarding how common ADHD is, the APA mentions that ADHD affects approximately 7 out of every 100 children worldwide, making it one of the most common neurodevelopmental disorders in childhood. However, prevalence rates may vary significantly across countries, ranging from as low as 0.1% to as high as 10.2% among children and adolescents. These differences may reflect variations in diagnostic practices, awareness, and access to care. Notably, ADHD is more prevalent in vulnerable populations such as children in foster care or correctional settings. Risk factors for ADHD. There are temperamental, environmental, and genetic physiological factors that may increase a child's risk of being diagnosed with ADHD. Children with ADHD often show temperamental traits that make self-regulation difficult. They may struggle to control their behavior, experience intense negative emotions, and constantly seek out new and stimulating experiences. These traits can make everyday situations more challenging and contribute to the persistence of ADHD symptoms. Environmental factors also play a role. They do not cause ADHD, but instead shape how it develops. Prenatal smoking or drinking and exposure to neurotoxins can increase a child's risk for ADHD. Moreover, stressful or chaotic environments can amplify core symptoms of ADHD, while supportive and structured settings can help children manage them more effectively. Together, temperament and environment interact to influence the course of ADHD over time. Regarding genetic physiological risk factors, the APA states that ADHD has a strong genetic basis, with heritability estimates around 74%, making it one of the most heritable psychiatric conditions. It is important to note that it is not caused by one single gene. Moreover, many genes contribute to its development, each with small effects. Beyond genetics, physiological factors also play a role in the maintenance of ADHD. Medical conditions like epilepsy and nutritional deficiencies can influence ADHD symptoms. Regarding family interactions, it's crucial to understand that they do not cause ADHD. Instead, they can shape how the disorder manifests and evolves over time, especially in terms of behavior and coping strategies. 3 evidence-based methods of treatment are highlighted for the treatment of children with ADHD. Method 1 is the behavioral parent training, BPT. Method 2 is pharmacological treatment, and Method 3 is neurofeedback training. A study done in 2023, Marquet Doliak and colleagues studied the effectiveness of behavioral parent training. Behavioral parent training, or BPT, is a structured approach that teaches parents how to manage their child's ADHD symptoms and improve family dynamics. It emphasizes the use of clear rules, consistent rewards, and calm responses to challenging behaviors. BPT helps to lower the parental depression and stress by helping parents feel more confident and reducing negative parenting patterns. BPT is grounded in cognitive behavioral principles and has been shown to effectively reduce core ADHD symptoms like inattention and hyperactivity. It also supports the development of social skills, emotional regulation, and mental functioning in children. The benefits of BPT have been observed to be maintained for up to 12 months post-treatment. A study by Peterson and colleagues in 2024 assessed the effectiveness of various pharmacological treatments for ADHD. Pharmacological treatment in ADHD in children has shown strong effectiveness, especially with stimulant medications like methylphenidate and amphetamines. These medications significantly reduce core symptoms of ADHD. Stimulants increase dopamine and norepinephrine activity in the prefrontal cortex by blocking their reuptake and enhancing synaptic transmission. Non-stimulants such as guanfacine and atomexetine also help by moderately reducing symptoms and improving disruptive behaviors. Both types of medication contribute to better overall functioning in children. Non-stimulants like atomexetine inhibit norepinephrine reuptake, while guanfacine and clonidine act on alpha-2 adrenergic receptors to modulate prefrontal cortical activity. Notably, Peterson and colleagues highlight that both classes of medication, stimulants and non-stimulants, improved overall functioning. In comparing stimulants and non-stimulants for treating ADHD in children, stimulants consistently outperform non-stimulants in reducing symptoms and improving overall functionality. Peterson and colleagues highlighted that some studies explored combination treatments where stimulants were paired with alpha agonists like guanfacine. These combinations offered only small additional benefits. It's important to note that the data in this review primarily applies to school-age children. They also mention that there is limited research available on preschool-age children and on the long-term effects of these treatments. Peterson and colleagues mention that pharmacological treatments for ADHD, while effective, can lead to a range of side effects and adverse events. Cardiovascular effects include increased heart rate and elevated blood pressure, and in rare cases, there may be a risk of more serious heart problems. Psychiatric side effects can involve agitation, anxiety, and irritability, with rare instances of hallucinations, confusion, or psychosis. Physically, children may experience insomnia, appetite suppression, headaches, tremors, dry mouth, and stomach pain. Additionally, stimulant medications carry a potential for misuse, which can lead to physical or psychological dependence. The third method outlined that is evidence-based. According to Moreno, Garcia, and colleagues, neurofeedback training is a non-invasive brain training technique that helps children with ADHD learn to regulate their own brain activity. It works by using EEG sensors to monitor brain waves in real time. When the child produces a desired brainwave pattern, like increasing focus-related beta waves or reducing drowsy theta waves, they receive immediate feedback. This feedback often comes in the form of a game-like interface. The goal of the treatment is to reduce the core symptoms of ADHD through the modification of abnormal neurowave patterns. For example, a child might control a spaceship, a race car, or a cartoon character on a screen. The longer their brain stays in the target state, the better the game goes. This makes the training engaging and fun while also reinforcing self-regulation skills. Over time, the brain learns to maintain these healthier patterns on its own, leading to improvements in attention, impulse control, and behavior. Neurofeedback training is effective for children with ADHD because it directly targets the brainwave patterns that underlie the disorder. Children with ADHD often show an imbalance in brain activity, typically too much slow wave theta activity and not enough fast wave beta activity. Neurofeedback training helps normalize these patterns through repeated training. As a result, it leads to measurable improvements in the core symptoms of ADHD, reducing inattention, hyperactivity, and impulsivity. It also enhances cognitive functions like working memory and executive functioning, which are crucial for academic and social success. What makes neurofeedback especially promising is that its effects are long-lasting. Multiple studies in the review found that improvements were maintained for 6 to 24 months after treatment ended. It's also a safe, non-pharmacological option. There are no significant side effects, making it a great alternative or complement to medication. Moreover, because it supports learning and development, many children show gains not just in symptom control, but also in school performance and social behavior. Regarding a biblical perspective, each of the treatment options for ADHD behavioral parent training, medication, and neurofeedback reflect biblical principles of wisdom, stewardship, and care. Proverbs 18:15 encourages the pursuit of knowledge and discernment. By seeking evidence-based interventions, parents demonstrate wise and thoughtful care for their children. 1 Corinthians 6:19 through 20 remind us that our bodies are sacred and should be honored. Supporting a child's physical and mental health through responsible medical and behavioral treatments is a way of honoring that responsibility. Whether through structured parenting, pharmacological measures, or neuro-based training, these approaches help children flourish in ways that are consistent with biblical values of nurturing, healing, and growth. This concludes the presentation. Thank you for listening.